Uh, so I have with me today Dr. Nadine Gracia. She is the president and CEO of Trust for America's Health, and Dennis Worsham. He is the director of the Snohomish County Health Department. I just said this on the floor moments ago, but an ounce of prevention is worth a pound of cure. And the COVID pandemic really showed us how painfully true that is when it comes to public health. Despite our public health system's central role in protecting our communities, keeping our families safe and healthy, and preventing major disruptions to daily life, our public health system was sorely underfunded before COVID struck, and it has been severely overwhelmed ever since. So we have got to do better, and that is what the Public Infrastructure Saves Lives Act is all about. Ending this cycle of crisis and complacency, and by providing dedicated annual investments for our public health system in every zip code across the country. To my Republican colleagues, this should not be a partisan issue. It should be common sense, because every dollar that we invest now saves us many more in the long run. We are talking about stopping the next global pandemic and the next global economic crisis in its tracks. It will save many lives and livelihoods. So I'm very proud to reintroduce this bill, and I'm going to keep pushing to get it passed into law, because we cannot afford to let our eyes off the ball and repeat past mistakes. So I'm glad to have with me many partners like Dr. Gracia and Director Worsham, making clear why we've got to finally invest in our nation's public health systems so we can save lives, we can prevent disruptions, and we can save money in the long run. And the Trust actually put out a new report today that offers some very useful insights into the history of insufficient federal and local funding for public health and recommendations to better support our communities, especially addressing health inequities and a growing public health workforce. So I'm delighted right now to turn it over to Dr. Gracia to say a few words, and thank you again for joining me today.
Thank you, Senator Murray. I'm truly honored to be here today as you reintroduce this critical legislation. As you mentioned, my name is Nadine Gracia, and I'm the president and CEO of Trust for America's Health, or TFAH. TFAH is a nonprofit, nonpartisan public health policy, research, and advocacy organization that's dedicated to promoting optimal health for every person and community and making the prevention of illness and injury a national priority. Today, my organization released an annual report called The Impact of Chronic Underfunding on America's Public Health System. And in it, we find that decades of underfunding have left the nation's public health system less prepared to protect the health of Americans. Passage of the Public Health Infrastructure Saves Lives Act is among the report's top policy recommendations. And there are a few reasons why this legislation is so important. First, long-term underfunding has weakened the nation's public health infrastructure. This has led to many health departments having antiquated data systems, insufficient public health laboratory capacity, and an under-resourced workforce. In fact, only an estimated half of the US population is served by a comprehensive public health system. Second, most funding for public health is tied to specific diseases or conditions. And while that funding is important to addressing specific health conditions, there's been little flexible funding for cross-cutting public health capabilities like those supported in this legislation. And third, public health funding has experienced a roller coaster cycle of attention and neglect. That means policymakers let public health funding stagnate, then when a crisis hits, like COVID-19 or Ebola, they may provide an influx of funds. However, when the crisis appears to have subsided, we again see budget cuts or rescissions. And this boom and bust funding makes it difficult to sustain the public health workforce that is so critical to address not only public health emergencies, but also ongoing challenges like chronic disease and opioid overdose prevention. In fact, in a recent survey, it found that nearly half of state and local public health employees left their jobs between 2017 and 2021. So the Public Health Infrastructure Saves Lives Act would be a sustainable source of funding to build the foundations of public health in states, territories, and localities, and it would help detect health threats earlier, communicate more effectively with the public, and build capacity to address health disparities. The bill also contains important accountability measures to ensure that the infrastructure investments are helping health departments meet national standards. Every community deserves to be protected by a modern, appropriately resourced public health system. And we commend Senator Murray for her leadership on this issue and look forward to your questions. Thank you.
Director Worsham.
Yeah, thank you so much for the opportunity. I just want to start on a personal note before I go through some major talking points that I think are important to this information. I've just, during the pandemic, had the opportunity to be the interim director for King County Public Health System and really worked with a really powerful and wonderful team there through that time. I've had the opportunity now to move back to Snohomish County as the director, where I actually started my public health career 30 years ago. Came in during the HIV crisis and served our community in addressing HIV from where we were at in the 90s. When I left our health department in Snohomish County in 2005 to go to King County, we had over nearly 350 employees. When I returned, learned that just before COVID, that workforce had dropped by 2/3 and we're down to just barely over 106 employees. Now, you may remember that in Snohomish County was the first incident of a reported case in the United States. So to have a workforce that had been depleted by 2/3 of its workforce to now be facing a national crisis in our first reported case, you can imagine the swirl and the time it took to rebuild an infrastructure to be able to respond to a pandemic was quite critical. So I am really grateful for this sustained funding recommendation where we really need to do on our infrastructure. I'm in a health department who also still receives all of its reported cases through faxes. So which means through our healthcare system, we receive a fax, then we have to enter it into a data system before our disease investigators can even respond to where we're at. So the language here that Dr. Garcia and Senator Murray has shared here is a real living thing I'm experiencing as a new director in our local health department. During my time in public health, both in Snohomish County and King counties, we've been really fortunate to see cycles of funding, much needed funding from our federal partners and our federal infrastructure around public health. This has been focused in particular efforts like preparedness and emergency diseases such as Mpox and COVID that have recently plagued us. This funding has been important, but it also has been short-term. When the funds expire, we lose experts, we lose staff, we lose expertise, and we have to cut back our programs in this crucial work. Community connections that were made and partnerships that have been gained and established through the healthcare system and in the community are broken. Trust is broken, and we abandon these communities because of a lack of funding until the next disease should come along. Short-term funding can be helpful to respond in an emergency, but we do need the sustained funding to be able to protect our community, reduce health disparities, and really address the safety concerns for many of our community members. We do need long-term, stable, predictable funding to bolster local health departments and to equip us with dedicated teams to better meet the challenges of an increasing complex world. We've seen over the last few years that a new virus or a disease is just a plane ride away. COVID ravaged communities locally, nationally, and internationally. The response is much different today as we've shifted from an emergency to a long-term disease prevention effort, but the response has not ended and it won't. Funding may expire, but these diseases do not care about funding or timelines. Environmental health threats, if I may, are not things that we have in our budget or our timelines that we are predicting. But we do know that they come back every year, as we've seen on the East Coast in the past several weeks. Snohomish County, we started talking about our upcoming heat and smoke season the very first sunny day of the year, as we know that those things are coming and we have to respond from a public health perspective around smoke and extreme heat, because we don't know that they are worsening with time. Public health is also a key partner in this daunting and ongoing response to the opioid epidemic, which has been identified repeatedly by our community as one of the biggest health challenges facing our residents. Last year, drug doses claimed more than 5 lives a week on average in Snohomish County. And we know in many larger cities throughout the United States, those numbers far exceed in a single day. And through all of these crises and through, although they may make headlines, my team also is keeping up with everyday, often invisible work that keeps people healthy, from food safety inspections to sexually transmitted diseases, education, tobacco, and vaping prevention. I am very proud of the work of our diligent team, but we do need to sustain the funding that we have so we do not return back to those days of lower staffing models before the pandemic. Funding like this that is proposed in the Public Health Infrastructure Saves Lives Act will do exactly what it says. It will save lives. I am grateful for Senator Murray, your continued support and dedication to assuring that we have an adequate funding system within public health to respond to our daily challenges and our emerging threats. Thank you.
Thank you.
Great, and we have time for questions if folks could raise their hands and we will call on you. Okay, seeing no raised hands. If anyone else has a question, you can also just unmute yourself and say your name and your outlets. And if not, Senator Murray, I'll turn to you for any closing thoughts.
All right, well, thank you all. This is so important. We all remember the terrible times we lived through with COVID. That was one issue. I think Dennis Worsham outlined so much of what our public health systems do today. Everything from warning people about smoke that we inevitably will see again this year, to measles, to all kinds of different aspects that all of us need information about. We want to prevent the next COVID pandemic that caused us so much disruption in health, so much economic disruption. And as we heard from Dr. Garcia, this is really important for our country. So our bill will provide mandatory funding to make sure that every county has a public health system that is sustainable, that has the workforce, that is ready, that is providing the information that they need so we can prevent the next COVID issue that comes before this country, and we all know that will happen.
Okay, great. Thanks again, everyone.
Sorry, before we close, Corwin from Northwest Pacific News Radio had a question in the chat box. How much funding does the bill ask for? How would it be distributed by county, depending on size, grant applications? And you touched on that in a very top line level, Senator Murray, but if you want to expound just a little bit.
It provides mandatory funding for states, tribal, and local health departments. It begins with a mandatory funding level of $750 million that ramps up over time and is distributed to counties through a formula that is based on specific needs, from everything from population size to burden of preventable disease, disability, poverty rate. So it's a formula funding to communities. Every county in the country will have access to these funds.
Okay, and seeing no other questions, I think we are good. Thank you, everyone.
Thank you.